guys, it's Dr. Denny over at Fort Plaza Culture Veterinary Clinic, and Maddie and I are going to be chatting a little bit more about some frequently asked questions about cat microchipping. So she's going to go ahead and get us started.
Dr. Denny, how is the microchip implanted in my cat?
So we use so there's little like syringes, but they have a bigger needle on the end, and what we do is we inject that underneath the skin, typically between the shoulder blades.
How do I get my cat microchipped?
So the great news is that you can come to the clinic, and we actually do perform that here. It's very quick. It may sting just for a second and then it's over. Most cats are totally fine right after it happens, so are dogs. But it's something that you can get done here. There are some animal rescues, animal shelters that will also perform this service. And if you're brave and watch YouTube videos, this might be something that you'd be willing to try at home yourself.
Where in my cat's body will the microchip go?
So I like to do it between the shoulder blades because it's easy to find. That's going to be the easiest place to scan on a cat with a microchip scanner. So if your cat does get lost and someone finds it, especially if the cat is scared, it's a lot easier to reach right back here than like down on a leg, because cats are very quick and they're very agile.
Is microchipping painful for my cat?
So we do use a larger needle, so it is going to sting. I can't tell you that it's not going to hurt, because it is going to sting a little bit. We do it on awake patients all the time. I do prefer, if we're spaying or neutering your cat, your dog, etc. If we're going to microchip, I do prefer to do it under anesthesia, because I don't like my patients to feel pain. I'm also a huge baby when it comes to needles, so I put myself in my patient's shoes, and I would much rather be asleep. But we do this on awake patients all the time, and they do just fine. There is a little sting, and then it's over. It's a teeny tiny little chip. It looks like a blade of like a little thing of rice. That's how small it is.
Are there any risks or side effects associated with the cat microchipping process?
So usually not. I will say, with my mother having 30-something years of veterinary experience, no. With my additional almost 10 years now, no. I will say the only thing that I have ever seen, and I've only seen it once, was and I think it was a dog. I don't think it was a cat. But I did see where the body kind of made a little wall of tissue underneath the skin around the microchip. And the owner was concerned and thought it was a tumor, but it ended up just being some scar tissue around the actual microchip, and that didn't cause a problem, but it was something that we saw. But once again, that's literally the only thing I've ever seen. So no, I really don't think there's really many risks or side effects.
Is a recovery period needed after microchipping my cat?
1 second. It's 1 second. It's literally like one Mississippi and it's done. It's one little sting. Sometimes I'll hold pressure on it for like another couple seconds, because it can bleed just a tiny little bit. But it really is just a few seconds. It's probably one of the fastest. It just stings for just a second. That's probably one of the fastest procedures that we can do.
How often should my cat be scanned after implanting a microchip?
So I like to do this on new patients that we've never seen, just to make sure we have the number correct in the computer. After that, if this is a patient that we've seen, every single year, I generally won't scan again. I think if you every time you go to a new veterinarian, yes, we scan every patient when they're new to us. without fail. And we make sure their number is correct in the computer, and we make sure the owners have those numbers. So usually just that one time at a new facility should be good. If you are concerned that the microchip has moved, because it can migrate, it can move from the place of insertion. And some people may inject it differently. I know that we have had patients where it wasn't us who placed the microchip, but it was someone else, and we found it like down the side or like down a leg. And I'm just sitting here going, how did you do this? Or maybe the patient wasn't awake. But the microchip can move. So that's why when we scan patients, and if you ever watch my team scan patients, it's like a game of Twister. We go all over, because you just never know. Most of the time it's gonna be right back here between the shoulder blades. But like generally one time scanning and you're good at new facilities. So I hope this helped answer some of your questions you might have. If you have questions or concerns, or you do want to get your cat microchip, please give us a call and we can get you an appointment.